7 a.m. and 8 p.m. You'll come in through the main entrance here in the center of the hospital. So this side is the emergency room entrance. You come here if it's after 8 p.m. and before 7 a.m. Or if you're coming to the hospital and you're less than 20 weeks pregnant, this is the entrance to come through. During COVID-19, things might look a little bit different than they did before. Anyone coming into the hospital will be asked some screening questions about symptoms or travel. If you're a visitor, currently you can't come into the hospital if you have those symptoms, but the screening will let you know. You also might be asked to wear a mask or not, depending on the current criteria. You can ask the security guard at the entrance to the emergency room to escort you up to the obstetrics floor. If you're too uncomfortable to walk because you're in labor, there is a wheelchair here for you to use if you'd like. So here we are walking from the emergency entrance down the long hallway to the main entrance and elevators, which you'll take up to the second floor to the obstetrics unit. Here we are in the main entrance of the hospital, in the center of the hospital on the ground floor. This is where you'll come between 7 a.m. and 8 p.m. if you're coming up to obstetrics. Take these elevators right to the left. I've just stepped off the elevator on the second floor of Stanton, which is the floor that has the obstetrics unit. Follow signs for obstetrics, which means labor and birth, and we also sometimes call it OBS for short, so you might hear that term. And I'll take you down this hallway. Why don't we talk about some reasons why you might want to come and get checked out at the hospital on the obstetrics unit. There's 4 main things that you might want to come to get checked out for. One is if you're wondering if you're in labor and you're having regular painful contractions. We usually use what we call the 411 rule or 511 rule, where if the contractions are happening every 4 or 5 minutes, lasting for 1 minute each, and that is going on for 1 hour, that's the 411 or 511 rule, and that might be strong enough contractions to be putting you into labor. If you meet that criteria, come on in and get checked out. You might not be in active labor yet, and it's common to be assessed and then sent home again to labor at home for a little while longer. Don't worry if that happens, that's very normal. Other reasons why you might come is if you think your water's broken. Often it feels like a big gush of warm water, but sometimes it's just a little bit of leaking. This is the main nursing station on obstetrics, and the first people you'll meet when you come in the door. So you can just say, I'm here to have my baby, and the nurse will walk you down the hallway to the labor rooms. You'll be assessed in one of our assessment rooms first, and then if you're an active laborer and you need to stay in hospital, we'll move you across the hallway to one of our labor rooms. It's common to be sent home if you're in early labor or if everything's looking good and you don't need to be kept in the hospital. That can even happen several times. You might come, be assessed, you can get sent home with pain medication if you wish, and then come back when things intensify or you have any other questions. This is one of our labor rooms. Over 600 babies are born every year at Stanton in one of the 3 rooms that looks like this. So in your room you have the labor bed and a spot for your support person or partner. There's a bathroom with a shower, stand-up shower and a bench. A lot of women like to use the hot water in labor. Our birthing tubs are not yet operational, but we'll let you know when they are. We have many other pieces of equipment to help with your labor, such as birthing balls, birthing stools, bars, mirrors for feedback, and anything else that you might need, you can ask your nurse for. In labor, your nurse will be here with you one-on-one, designated for you and your care. Your doctor will come in and out and assess you at any times that the nurse needs, and the doctor will be a doctor who's on call for that 24 hours in hospital. I'm one of 10 family doctors who does deliveries here at Stanton. We also have obstetricians on call and pediatricians on call for any time that we need them.